I matched here and I was super excited, moved here, and then I was like, well, nothing can be, match my expectations. And, usually your expectations are too high, and then you're kind of like, oh, well, I wish they didn't do this or didn't do that. Since being here and experiencing everything, there's not a thing I would change about the program. Everyone has been so supportive, so helpful. All the teaching has been amazing. And I just wanted to say, from my experience, moving across the country, it was 100% the best thing ever. And I'm so excited to be part of this emergency medicine program.
So I think UConn is a very special place to be and train for several reasons. It is a place where it has a lot to offer. There's not just one hospital that UConn Emergency rotates with. There's 4 hospitals. And I think that's what makes it special. You get a wide variety of the patient population at Hartford, at St. Francis, and we have our own children's hospital, which is right next door. And then you also get the community experience of going to John Dempsey Hospital. I think you have a wide range of attendings that you can learn from. But most importantly, I think the one distinguishing factor that UConn offers that not too many other programs do is that we're a big, well-knit family. And I think the senior residents especially watch out after the younger residents, and the attendings watch out after all the residents. I don't think you get that camaraderie and that feeling of a big family anywhere that you go. And that's what really makes this place a defining place for me.
I love it here. I think probably some of the things that I love the most are how sick the patients are. It just makes for a really interesting day when you can kind of get a little bit of everything. And just the population in Hartford, I think it's really nice to take care of sort of the underserved and the Spanish-speaking population. It's really satisfying for me, so that's what I like about it.
Yeah, what do I like about the program? What is there not to like? It's a very family-oriented type program, so everyone gets to know each other very, very well. And we have great ultrasound training. So the faculty here is very dedicated. We have a lot of access to ultrasounds and plenty of pathology to see. And then in addition to that, we have a great simulation center. Fantastic faculty, great resources. It's integrated into our curriculum, so you get those very rare procedures that you can do on a routine basis.
I mean, I came here when I was a student and fell in love with not only the place but the people, and it was very serendipitous for me to end up here as a student, and then to match here was one of the best days of my life. I remember screaming down the streets, and my neighbors came out and they were just like, "Whoa, what's going on?" And I told them I matched, and it was fantastic. And every day since then has just been better than the last. And you come to a place and you look for pathology, you look for the type of hospital and the amenities, but what you forget about and what actually matters the most is the people and the family that you create. So that's what I love about this place.
I couldn't agree more with Sagar. This has been the best place to be, and I'm so happy to have matched here and spent the past 2 years here, and I'm excited to hopefully stay here in the future. As Sagar said, it's the best people. You learn something every day. Everybody cares not only that you're learning and learning a lot and practicing good medicine, but everybody cares about you as a person, and cares that you are well and happy and have a happy home and family life, and are also happy at work, and just do everything for you to make you the best doctor and person you can be.
Coming from a state where I didn't know anyone and going to another state where I didn't know anyone, it was important for me to find a place where I would feel comfortable. Residency is hard wherever you go, and it's important that you take away some of that stress by being in an atmosphere, and around people that you can consider family, and I think that's what I found. This is a program that focuses on wellness without taking away from the quality of the clinical as well as the didactic experience, and I think they do well to combine those elements.
Everybody is so amazing and great, and they help you no matter what, and the doctors and the nurses work so well together, and they have just this open communication that I really never expected. And they tell you all these things in school, and I never expected that the communication and the camaraderie would be so great there, and I absolutely love it.
I like that we also have really great ultrasound training, and I love ultrasound, and also, in terms of sick patients, we have a lot of people who ingest lots of different stuff, and so if you like talks, you get to see that all the time, so I like it a lot too.
Yeah, our ultrasound director is probably the most enthusiastic person
She's the best.
anybody will ever meet anywhere.
She's the best ever.
And that enthusiasm is infectious. One of the things that I think of first about UConn is that we train at Hartford Hospital, where we see super sick patients. So every day you read something about some random disease, and you're like, it may be months before I see this, and inevitably later in the week you see that super sick patient, and you're ready because you're seeing it all the time, and every day I get to look forward to learning how to stabilize another critically ill patient.
So happy that I'm at UConn. I feel like my classes really come together as a family. I feel that I can count on them. I can, we not only have a good time working together, but we also spend time outside, and I feel like that's what I was looking for in a program, and I'm really happy to have found it here.
I agree with Andy. Being from out of state and from Atlanta, I moved here and didn't know a single soul in the entire state of Connecticut, but I feel like the program really kind of just gave me a big hug, and I've made a lot of friends here. And like Andy said, aside from just working with a bunch of wonderful, smart people, to be able to hang out with them outside of work and really get to know each other has been great. But I feel like the environment in which you learn how to be a doctor is also equally important. And I feel like the people here, it's a very supportive learning environment. So that was the main thing that attracted me to the program, was the people.
It's been a great experience. Hartford has the sickest of the sick. You see everything that you could possibly want to see. It's been a great year. I feel like I've really learned a lot.
Originally from the Midwest, wanted to do something, go somewhere different. And what I loved about UConn is that it is a smaller city, but has a very high volume and high acuity hospital, which I think is perfect to train in.
I mean, the people here, the attendings are just awesome to work with. When you're rotating through the department, they're just always there, just love to teach, love to help you out, love to seek out opportunities. Some crazy stuff comes through Hartford, just tons of really sick people, and you learn a lot from them. So I don't have any regrets.